we are ready to continue. We'd like to welcome the Minister, Ms. Agapidaki. You are the first minister who has a portfolio, public health, and this is something formidable. We should take note of it. And with this portfolio, you have introduced prevention in our life. You often talk about the value of prevention, but what do the citizens really understand? Because, okay, as a concept, we can grasp what it means, but what it means in practice. What is your strategy as of now? Because we have an iconic program. It has been successful. What's next? Good afternoon, everyone. Thank you very much for the invitation and for giving me the opportunity to have a discussion with Mr. Souliotis, a discussion about prevention, a topic that you know very well, Kyriakos. I can see many people in the room who are also involved in this sector. I want to say that indeed, and I'm saying indeed because during the last few days I had the luck of taking part in the summit conference, to take part in the different side events that were organized in the margins of the summit conference and meet people who are involved in this sector. And they, the external observers, actually certified that we no longer are observers of developments, but shapers of developments. We started with a prevention program, Prolamvano. This was a program that the country should have done decades ago. Personally, I remember, and I was writing when I was in the medical school about it, and all the academic community was insisting that we should have programs of screening, and we didn't. Thanks to this, out of the 6 million unique beneficiaries, 4 million have already taken their tests, screening tests, and we have 2,000 people having been identified early on with symptoms. Recently, it was announced that, especially with regard to cardiovascular diseases, in the context of the prevention program, which is far more specialized, so based on this program, the EU heart plant program will be based for the prevention of cardiovascular diseases. One main difference between the Greek one and the European one, apart from the blood tests, the LPA measurement, even of the children of parents with high levels of this protein, you understand that this is very important to identify early on in order to predict the profile of the disease that a child has. At the same time, we make cardiovascular tests reaching up to the ischemic test, and since there have been some hundreds of thousands of operations for stents on people who actually acquire this problem from a simple blood test, we now know that we have the obligation to encourage people to take these tests. But now, let's talk about preventive diagnosis. Our country was awarded by the United Nations for the major achievements it has made in terms of combating children's obesity and in terms of prevention. We are one of the few countries in the world that does not make fragmentary interventions. There are some countries that follow some specific and separate policies with regard to the salt or other ingredients. We have managed to reduce the concentration of salt, the concentration of sugars in food, always in collaboration with the food industry. Thanks to this collaboration, we have been very successful in this sector, and we will do many more. And apart from the program against children's obesity that has secondary and tertiary prevention, we will give the possibility to many children to learn how to eat in a healthy way. Families with financial problems will be given the opportunity to have cheap access to food. Moreover, we promote sports and also community actions in the context of which families get together, experiential learning is promoted. And this is very important because it is not part of the social tissue anymore, social fabric anymore. And of course, we also focus on the cessation of smoking. And I'm very happy because up until now we have 300 families that receive free consultancy services by a team of scientists. And we have already the results that show that we have a reduction of BMI in children. The Prolambano program will continue. We will soon have the new prevention program for renal malfunction. The people in the group with the cardiovascular diseases and that have been diagnosed with diabetes will have the opportunity to take a series of tests like ECFR, ECR. We will also continue the program for combating the obesity in adults. This program has now a lower threshold, a lower limit, not just BMI 40. We will drop from 37 for people with comorbidities, and the Public Health Committee actually has approved that. That is, it has approved to lower the BMI in order to give the opportunity to innovative treatments to be combined with consultancy on nutrition. So we will have a holistic approach to this. And of course, there are many more that I could talk about with regard to prevention, but I would like to stop here and say just one thing. One of the factors that we have been examining for long, since we believed that it was important in the success of this transformation we want to achieve, is the so-called political commitment. And just like Kyriakos Souliotis said, this was expressed in a country in the form of a high-level portfolio. And the people who work in the scientific sector understand how important this is. The Prime Minister is a person who has a deep knowledge of public health-related issues. I'm often impressed by his knowledge, and mind you, I'm quite knowledgeable. So the Prime Minister had early on identified the needs of such a portfolio in order for it to cover the lost ground. So I believe that political willingness is now a reality and will affect every citizen, the health organizations, all the people who work in the NHS, the scientific community. And I would like to say that the award that we have received belongs to all the citizens, to the health professionals, to the academic world, because without the work that they have been doing for so many years, and especially in the scientific academic world, the country wouldn't have been able to make these steps. So political willingness is important, and it is even more effective when it is combined with an alliance of all stakeholders.
Thank you very much, and allow me to congratulate you for the award as well, because we should remember that not in the distant past we were a negative protagonist in health-related issues. You remember that a few years ago all scientific publications had to do with the health system under the crisis that is panting and gasping for air and trying to meet these things. And we're talking about innovations, and these are conquests that we need to remind everyone, because it is their fate to be forgotten. Another problem was the fragmentation of the individual interventions. We had the primary care, and everything. There were things that lacked cohesion, whereas now we have these health groups. This is what you do to cover this gap and to improve the experience of the patients and the citizens and improve their confidence and faith in us. Will they become operative? Yes, we're starting the universal operation. We've been in more than 250 points all over the country, and I had the pleasure with the mobile units of the AOD to find myself in mountains of Eastern Macedonia and Thrace. There we had a series of actions, both in the community and at home, and what I can see, and it's something that I believe is easily ascertained by many other researchers, is the so-called unmet health needs. And this is a rate that you should pay heed to. It's very high, and it pertains to 2/3 of the people who do not go to health services. The social image, the social footprint, the social demographics have changed for good. We no longer have the situation that we used to have with the health services, and we're waiting for the citizen to come to us. We need to go to them. And this is not exclusive to Greece, and it has to do not only with the people who have socioeconomic inequalities, the poorer households, to put it in another way. It has to do with the people who are elderly, who live in the region without any support framework. The children are away. It has to do with people with disabilities, and there are very many In our country, early mortality has to do with people under the age of 70, and subsequently the multimorbidities and disabilities. So we have many people who are younger, of productive age, at home, who receive no support in health-related issues. So what do we do with the mobile health units? We bring the doctor at the patient's, or the citizen's rather, door, and something very important, and we have set a goal to reduce the unmet health needs by 50% by 2030, not with this policy, but I think it's the culmination of everything, because we see in the field what happens, and people who work in the mobile units can describe everything much better than I do, how uncared for is the population in health-related issues. How many people are alone? How many people don't know about main services, how to move from one level of treatment to other, healthcare? So the 1/3 that pays the excessive expense is all of us who know how to navigate the health system. We need to find the people who have low health literacy. They suffer the inequalities, they are cut off from this thing. They have a problem that usually scares them, and they don't know how to seek health services. So apart from prevention and healthcare, the mobile units make the link and walk the patient journey in the health system and arrange for their care, which is very important. Now, since you raised the issue of fragmentation of primary public health, this is something that used to make me mad in the past. The country had a huge weakness as a whole to understand where public health meets primary healthcare. Primary healthcare was the crutch of the hospital. It did not have the features and characteristics of primary healthcare as it does in other countries. And it dealt, as more masters they could, with the management of chronic diseases, and that is all. So we change direction, we shift gears, we make a tremendous change in collaboration with the WHO to bring the population approach to primary healthcare. This is the optimum model, the integration of public health to primary healthcare and vice versa, to depart from this model that we are, Eirini needs to go to the doctor, what is wrong with Eirini, the doctor will prescribe, will take the drugs, and that's it. We need to realize what is wrong, to offer the tools, offer the training to HCPs of primary healthcare to be able to offer at the population level drastic things to make these behaviors and mentalities changed. I must say that I have been present in various such actions of primary healthcare HCPs, and it is moving because the people are thirsty. They know that that's their work, and they've been trying for years to find a way, a pathway to do this job which they love, which is why they're still a part of the health system. At the same time, we have many people with chronic diseases in the community, even with very serious issues, and this new model of primary healthcare offers them the opportunity not only near where they live and work, at home. It will bring injectable treatments, something that started with Mother Themistoclou and the minister. In terms of hospitals, we will have, with the approval of the doctor and the hospital, the possibility to administer injectable treatments at home. It will alleviate the burden of the patients who find it very difficult to receive their injectable treatment every month, and they don't need to go to the hospital, so that we can slowly but steadily work in a more holistic way at the level of family. Because we see new problems emerging of mental health. It's a new scourge for the whole people. They have new programs with UNICEF that pertain to that sector as well, and other things, to be able to leave from the treatment to the prevention of disease. It is a brilliant innovative that will bring the healthcare system next to the citizen and will improve the system. And I would say that maybe there emerges a role for care in the more vulnerable households, and you see that the old fragmented policies now synthesize a plexus of intervention, because this is what we do in modern times. We see in these so-called unmet needs, the problem is the pathway. It's not systemic, that there is no available care or we don't have the resources. It is that you can't do anything due to the lack of knowledge. So when the system is going, knocking on the citizen's door, and they say which door that is, they meet an actual need. And one other thing that has been of concern to this conference, AI, you presented some applications that have to do with prevention. In the service provision area, we've seen them and we've been exposed to this new knowledge. What do we expect to see? Because there is torrentious changes coming up. Yes, indeed, and in a way we must understand that we need to train ourselves to live and operate in a new healthcare environment that has already changed, and in the next 3 to 5 years it will change completely. I mean, it will not be a substitution of the doctor by someone else. I mean, this is really something that is so invalid, and if anyone believes it, really does not understand what medicine is all about. What AI treats is the treatment relationship, which is why in all advanced countries, all medical schools try to go the extra mile to be able to allow the doctors and the HCPs to develop the skills for a good treatment relationship. AI tools in prevention come as an assistance to this part, to be able to train you, to awaken us, to realize our needs. For instance, by clicking or by pressing our finger against the camera of our mobile phone, we can have a full pre-assessment, which we will need to send to our HCP to see which tests we need to undergo and when. So instead of having a horizontal model, we will be able to move into more targeted prevention models in the future. The women who are pregnant, they can know at which week they need to check their gestational diabetes with a special device that can be incorporated to the mobile phone. The doctor may see the data, they need to see which extra tests they need to follow gestational diabetes no matter where they are. And something very important thing that is to the assistance of both doctors and patients, it's the HiScribe tool. Leaving the doctor, we will receive a full report of what we said, what was the problem, which tests we need to make, and it will be sent to the doctor as well. Reminders regarding our drugs, explanations. Research has shown that the citizens the world over prefer this sort of instructions because they're more detailed, and usually the doctors don't have the time to talk with the patients and speak time and again and share these explanations, and this helps with adherence to treatment. And we have a new application, a new service, which does the triage, either via mobile phone or at the health centers, and it provides medical advice. We can have a burn or an injury, trauma. We can photograph it, perform this triage and evaluation, and if something very serious, to automatically notify the ambulance service, a CAV, to come pick us up, or to give us an instruction to go to the pharmacy, receive cortisone ointment, or if we have a bite or whatever, or to see a doctor and to have the options to make an appointment automatically. I'm saying all these in a nutshell, but behind this there is a huge ecosystem that has to do with health data. And it is not limited only to health data, because the country develops on the basis of the Israeli system a new data ecosystem for medical data, health data, environmental data. Everything has to do with whatever impacts health. And my personal goal is for the person who will succeed me once the Prime Minister decides that my tenure is up with the Ministry of Health, is to find a series of tools already set up and to know how to schedule the health services in northern Greece based on the epidemiological data, the demographics, and the risks, be they environmental or personal, rather than to need time and again to improvise. And I'm saying this as a person who does not come from the political womb traditionally. I come from a different area, and I find interest in these things continuing. And if there is one thing I realized in my time in policy, and I do aspire to keep on being in policy, and I do believe that I did well to leave the university and other people should do this, this is the only way that we can make actual actions the things that are theory. I'm not underestimating research and theory, but we want actions. We are people who want to see action in the field, and I think that we owe it to ourselves and the people we're serving to move on to another field, either to the design and tracing of policy or politics in specifics. Now, I've said this time and again, it's like a relay race, okay? You pass down the torch to the next one. And I know now that when a traditional, let's call him politician, has the tools and they know that there is funding, there are the tools, and all these things are safe and secure, it is very easy for them to continue. So the things that used to be interrupted in the previous years, or we allowed them to be interrupted, or we stopped and rebuilt, is gone, okay? Building in terms of reliability and sustainability is about the tools and about the people. Yes, I will agree. We were talking about the necessary change in culture that does not happen automatically. We see that prevention comes in our country because there is a systemic difference in culture. The system decides to make it a priority and make it action. This is the difference. Now, during your development from the academic world, that I had the fortunate enough to meet you there, someone is, you deprive them of yourselves. Okay, it's very holy, it's very important. The area of research is privileged and you can say whatever you want and you are judged by your students and your peers only. So I want to thank you so very much. One final comment or a question. Is there anything else you would like to announce, share with us? What else is there for us to wait? These are brilliant programs. They're compact, they're robust. We familiarize ourselves with them and we're waiting for them. And they're cost effective. Yes, this is 100% right. This is my turf. Okay, so I'm waiting the next project with the symptomatic, the asymptomatic, which is the monitoring, the pre-trial monitoring, that used to happen. And we've seen this for a great number of years, and we all said that it will never happen. So what it takes is political will, except for skills. Now, what about one last word to bid goodbye to everyone? Yes, thank you very much. I want to say that the country must be extrovert in a dynamic way. And I'm saying this at the level of researchers and scientists. Most of us have experienced how we were dealt with during the crisis years in the international conferences and elsewhere. These things have changed. The country is not lagging behind. We're not a straggler. We may have substantial problems in the funding of research. We need to take more steps in health. I mean, Minister Kyriakos said this, there is no Minister of Health who is totally satisfied, everything is perfect. It is a dynamic system that needs to keep on improving itself. But I believe it's very important for us to have a dynamic extrovertness to evaluate and assess everything we do. If we have assessments and at the same time good results, we have nothing to fear. It is very, very important for us to realize, and it's something that I have fervently believed for a number of years. If it can work in Greece, it can work everywhere. We have a geography and some components at the level of health care and science in general that actually click with the needs of many references. And if something works in our country, it's very easy to be adapted. And it has been requested by the Prolamvano, the preventive and the child obesity program, other EU countries. So we need to be proud, we need to be optimistic, and to know that with hard work we can move ahead. I think this is the best possible message to close this debate. Thank you very much, Alternate Minister, for your time.